government also. I don't know because the meeting is still on the our extension of lockdown meeting is still going on at the Vidhan Soda, the expert committee. I don't know how many of them will join. I've just come to my car and I've sat and because very important session. I've just wanted because Krishna Arjun told me it's very important, so I've come back. So let's see whoever is joining. Thank you once again. Go ahead, doctor.
Yeah, sure. Krishna, let me know once we can start.
Yeah, I think we can start in a minute. Kiran sir, I'll also be sharing the YouTube link. We are live on YouTube. So in case someone is not able to attend the meeting, they can watch us live on YouTube or later on refer the same video from the same YouTube link.
Fantastic.
So, yeah, thank you, sir.
We can also send it to other parts of the town like Gulbarga, Raichur, and all those people.
Definitely, sir. Definitely.
Yeah.
The YouTube
Yeah,
link will be
yeah,
accessible.
I'll share it right away.
Perfect. Yeah. All right. Dr. Anurag, if you're ready, we can start. We'll let people come in as and when they walk in. So
Sure. Sounds
like
great.
Yeah. So we can start with the brief introduction.
Krishna Arjun,
Yes,
can you
yes,
just
sir.
wait for 2-3 minutes. Some of them are just coming in, logging in.
Sure.
Let's give us 2 minutes. Then you can.
Sure.
All right.
Okay. Because I want people to know who exactly Anurag is, Dr. Anurag is, and also in between, also you have to tell them once again when we have full crowd. At that time, also you must again come back and tell what exactly Anurag is doing it, and so wonderful to have somebody like Anurag and addressing all of us.
Definitely, sir.
My pleasure, sir.
So Anurag, before everyone joins, we'll be having a short Man Ki Baat. I read hepatology as herpetology. So it just just the R is missing. So why did you take up hepatology and not herpetology? What excited you or interested you to take this up?
If you see, all the organs in our body are so well connected, and when you get to learn about a lot of, when you get into medicine, you find interest in few things. And I loved how liver connected your intestine, your heart, your lung, your kidneys, basically the vital organs, and how it's important for each even minute thing, and how it can regenerate itself, and how only 30% of your liver is enough to sustain your life. So it was a very miracle thing for me, and it just made me think a lot about how it could work, how does this happen, how does that happen. And it just, the kind of interest just enlightened in me, and I went ahead with it, and I love this department, this specialization, and I love my team too. I wish my team could have joined me, but they are right now traveling for a transplant. And yeah, we are having a cadaveric donation going on. So we're just waiting for all the consent meeting to happen, and then we'll go. That's why I've come to the hospital on an urgent basis.
Lovely. So Anurag, my next question to you is, you're part of Rotaract, which is also focused on service and fellowship and grooming yourself to the next level. And you've chosen a profession which is all about service. So how does both go hand in hand?
Exactly.
What has been your experience?
I joined Rotaract about 4 years back. My president, Rotaractor Jagriti Geya, I was inducted as a member then. And one of the best thing character over there, I liked how he brought up the whole club together, and the kind of follow-ups he used to have with each and one of us. I loved it, and that's what made me also help following up with my patients. The kind of follow-up he did, it helped me like take that quality from him and learn from him, and that helped me a lot. I was the international service director under his presidentship, so that helped me a lot to build that kind of rapport with my patients, like how I used to have rapport with all the club members. So in that way, Joseph, I think he's there. So thank you so much, Joseph, for helping me take this from you.
All right. We'll go one more step ahead and request Joseph, who is the incoming DRS for the Rotaract district, and also the current ZRR, and one of my favorite Rotaractors, to introduce you, Anurag. and then
Sure.
we'll start off with your session. I think it's a pleasure for him. It's like you are a fan of Joseph, and Joseph is trying to introduce you. So it's a
I love
win-win
that.
for all of us.
Thank you so much, Krish. And I'm really happy that Anurag is here to address all of us and one of the best doctors that we have in our club. And yes, Anurag has been a great sport. Being a road tractor, he did an amazing job during his term as an international service director during my term. And yes, looking forward to hear from you, Doc. So that's from my side, and all the very best again for your wonderful work that you've been doing, not just in Rotaract but in your professional life, saving lives. So all the very best. Thank you.
Thank you so
Joe,
much, Joseph.
Yeah.
Joe, in fact, we worked on a couple of cases together.
Yes.
Dr. Anurag requested for some assistance, and we were able to help
Exactly.
him.
True.
So, just saving one life, the kind of satisfaction we got, and he does that day in and day out. So, very jealous of you, Anurag. But kudos to you. Keep up the good work. With that, thank you, Joseph and
Thank you.
Doc. It's time for us to understand these. We now had first had the bats, then the virus, now the fungus, and now we have color fungus coming in. So
Uh-huh.
we are very confused, and people are afraid. People are not sure on how to go about things. So please do share some light on what is the current scenario, what are the variants with respect to fungus, and how do we make sure that we are all safe, the kind of precautions that we could take. A brief on this, and then we can get into a Q&A, please. Over to
Definitely,
you.
definitely. Yeah.
Thank you.
Sure. So basically, the thing started around April, the whole wave coming in and things like that. So COVID is a very unique uh, disease, I would call it. See, according to my experience, I have been seeing with COVID is completely different. It's not leaving any part of your body currently. As of now, we're seeing every part of the body getting affected. Even if you take vaccination against COVID, you're getting some of the other side effects. This just saying that there is something with this virus which is very enlightening. I would call it enlightening to me because I love the subject COVID too. So what happens during COVID is they reduce your white blood cells. That's your immunity cells. So because this white blood cells are decreased in your body, you would have heard that when you do your blood test, your lymphocytes have reduced. So that's one of the main cells which fights in your body. So hence your immunity is compromised. So this is one of the thing which COVID does. So another thing which causes this kind of fungal infection in the body is poorly controlled diabetes. So diabetes is something India is known as the hub of diabetes. So a lot of people who are not taking care of their diabetes, and why we saw this kind of surge right now is because people were not doing their regular exercises who are diabetic, and they never control their diabetes, and they never had a good follow with their endocrinologist or anyone who's taking care of their diabetes. Third thing is the people who were taking steroids, who are taking any immunosuppressive drugs. Like I would tell with my experience, my patients who have undergone transplants and have come with mucormycosis post COVID. Why did that happen? Because his immunity was already suppressed because of the transplant which we did. We keep the patients on immunosuppression. Like that means we make sure that immunity is low so that the organ does not get rejected. So those are very specific. There is very specific criteria where these people, we're seeing very specific class of people who are getting infected by fungus infection. So fungus infection is, you can also have a fungus infection. I can also have a fungus infection in my body right now. But when does it trigger a symptom, or when does it trigger becomes a problem to your body, is when your immunity is low. So when does the immunity become low? Like I stated, you have COVID, your lymphocytes, your white blood cells have come down. Second thing is when your diabetes is not under control. Third thing is when you don't, when you just start taking steroids, or when you are on steroids, or you've unjudicially you're taking steroids without a medical practitioner recommendation. So these are the classical case we are seeing. About 90 to 95% of the cases are these group of people who have gotten these fungus. So the different types of fungus, like, if you ask me how do you get it, so it's naturally present all over the environment. It's present indoors and outdoors as well. It can be in your plants, it can be in your vegetables, it can be anywhere. So these are basically, these fungus are in forms of spores which are which we inhale it, and it can and it becomes harmless for a normal individual whose immunity is good. Only when your immunity is compromised is when this diseases or this infection starts to flare up in your body and cause problems. And if you think this is something new to the medical world, I would say no, this is not new to us. Where in 2003, if you realize, we had a SARS pandemic in the Mediterranean region. We saw something very similar in that time also in 2003. So that kind of helped us to understand and to know what this fungus is and how this fungus actually triggers the body. So we are able to actually understand this disease much before, not like it's something very new to it, like how COVID was. And so just remember, like what kind of symptoms do you get when you have COVID is like, I classified into three category: early diseases, which which affects your nose and your nasal area. Second is your eye involvement. The last is you're getting involved to your brain. So what are your symptoms when you start, like, when someone approaches you, or you hear a case of black fungus? How can you detect it? Is someone will have a blocked nose, someone will have some running nose, someone will have headache, persistent headache that does not reduce on painkillers, facial pain, your sinuses will start paining, your below the eyes, around the eyes, you'll have pain, and bluish blackish discoloration of your skin can happen, and ulceration of your mouth. This is another thing which is very different. I think from one patient we saw, he had ulceration on his upper palate. So one of the classical thing to look for. And then what happens, this is very early stage. If this is picked up early, can be treated very easily without, sometimes might not require even surgery. So second, advancing after going into your sinuses, it progresses to your eyes. So you'll see pain, swelling and redness of the eyes. Your eyelids becomes lower, we call drooping eyelids. You might be seeing double, you might have double vision. Sometimes when it progresses more further, you'll just lose a vision. So maybe you would have heard in today's news, like about a young chap got infected with black fungus, and two chaps actually, and both of them are going to lose their vision. So that's when it progresses to your eyes. And next is about progressing to your brains and other organs. I'm talking specifically with black fungus right now. So these are very classical with black fungus. It can be disseminated in the body also. We have seen a case with black fungus in the stomach also, in the intestine. Very, very, very rare, but it is actually seen post-COVID actually. So how do you know, when do you approach for medical help? Any of the symptoms which were stated above, you need to actually just get in touch with your doctor. And then what they'll do is they'll do a swab test and do a KOH test, which is for specifically for fungus. And then you might be advised for a CT scan or a biopsy or an MRI, and then take a call direct by the treating doctor. So what are the medicines we usually use is amphotericin B, which you guys will be very well averse about, because you might be getting queries about what is how do I procure amphotericin B. So these are all antifungal drugs. So we usually start this treatment usually goes for about 4 to 6 weeks of amphotericin B, and after that we switch over to posaconazole and isavuconazole. These are the other two drugs which prevents relapse of this fungus. And then surgery might be required if we see the sinus involvement a little too much. So something called FES is done. You put an endoscope through one of your a camera through one of your nostrils, whichever side of sinus is infected, and get into the sinus and just clean it up. So that's one of the thing to that's one of the way we manage this case. So like, you might be asking, now you have told me about all these diseases, how do I control it or not get it? So these are the mantras you should follow. Never self-medicate, especially steroids. It should always be done under medical guidance. Always track and control your blood sugar level post discharge, and like once you get discharged from your ICU, or after your general checkup also, or even if you're home isolated, I would recommend after 7 days and after 14 days, just do a random blood sugar checkup and see if it's spiked up, or it's in the normal range. Help you to monitor these kind of things. And in the and those who are diabetic, you need to have a very strict sugar control, and then watch for symptoms like I've told you before, and then maintain hygiene and cleanliness. So this is definitely a life-threatening and rapidly progressive disease with a very high mortality rate. Mortality rate means people who die out of this is about 40 to 80%. One of my post-transplant patient had died because of this, because he did not approach us on time with regard to this his symptoms. And coming to different colors of fungus which you'll be hearing, some are black fungus, some are white fungus, some are yellow fungus. These are fungus that their color is depicted of the things what we see on the microscope when we diet or when we put the things. So these are just named for our benefit, but these fungus don't look that way in a natural thing. So to give the scientific names to this, the black fungus is mucormycosis, the white fungus is the candidiasis, the yellow fungus is aspergillosis. So these are the few strains which we have found. And candidiasis is another very common infection, especially seen in women. Their genital tracts are commonly infected by this because of the altered pH. And aspergillosis is another troublesome disease which mostly affects your lungs and your stomach. So something to watch out for. Compared to black fungus, that is mucormycosis, aspergillosis and candidiasis are much more rarer incidents compared to mucor. Mucor is extensively seen currently. What I suspect is the use of industrial gas cylinders, which are not actually sanitized and not maintained hygienically as per a medical standard, because industries, you will have 100 of people, and because of sudden increase in oxygen demand, we had seen, the government had tried to procure cylinders from wherever possible. So that is one of the things. Using or usage of industrial gas cylinders, I think, was one of the most common reason for sudden surge of this case. And another thing is people just randomly started taking steroids. I still have patients who don't have symptoms are still on steroids. I like, you don't need it. Please don't invite new invitations. And why do they take it? Because they would have seen as a WhatsApp forward saying they were prescribed this medicine, so I'm just going to take this medicines. So that should not be done at all. And if you're a diabetic, please control your diabetes. Make sure your diabetic is under control. And any if you're on immunosuppressive medicine, like steroids for a long time, for many conditions you are under steroids, like you have an autoimmune condition, you are a post transplant, you are on ILD therapy, you are on asthmatic patients. Some of the asthmatic patients even take inhaler puffs. So that is one of the things, you need to control it. I mean, not control it, always have a doctor's advice about how to titrate the dose. Do not take any of these medicines by yourself unless it's advised by a doctor. So this is how I would like to summarize these things for you. Mucormycosis, it's an epidemic within a pandemic. So it is a very much controllable disease if diabetes is controlled and steroids are not overused or abused. And yeah, so that's how I would go about summarizing this. So we can actually take it very, very, very carefully, and we can actually treat it also if the patient comes to us in a orderly manner and within before the things go out of hands.
Thank you, Dr. Anurag. I think that was very well summarized. we do have a couple of questions that have already been shared by our team, which is working in the front line.
Uh-huh.
So, uh, yeah, you were
Yeah.
describing about the epidemic, epidemic and the pandemic, the varieties of viruses, fungus. I know we are all overwhelmed right now. Kudos to the entire medical fraternity to have stepped up and handling this so beautifully. Uh, like Devi Shakti sir says, none of the countries can be truly prepared for something like this, and you're going above and beyond, and the frontline warriors, our doctors, and everyone are doing a fantastic job. So, my first question to you is a common question that comes in. We want to know what to do when the medicines that are already described or prescribed for this particular condition with respect to the fungus
Mhm.
uh, is not available. Can't there be an alternative prescribed by the medical fraternity is the question. But this is a common question, and sometimes it's blatantly put in the media or social media in a way wherein the doctors are pointed out, but we have to understand that it has to be more responsibly handled. So what do you suggest in case we don't have the medicine in stock, and what is that alternative? Is there an alternative that they can actually look at? Is the question.
So currently, I don't think there is actual shortage of this medicine currently, because I have spoken to the pharma reps personally, and I have made sure that I've spoken to the heads of the pharma company personally, and they have promised me that these medicines have already ramped up. The production is already ramped up, and alternative to this is definitely, like I named it to you, like posaconazole or isaconazole, isavuconazole. These are the other two medicines which we can use, but amphotericin would always be the first line of drugs. If not that, we have another other group of antifungal drugs which we can give before we like there are, like my liver patient, I'll give you an example. My liver patient was not able to tolerate amphotericin B and had allergic reaction. So what we did was we switched to isavuconazole, that is another class of antifungal drug. And yeah, I mean, this was post surgery, because we had evacuated the whole fungus from the sinus, and then we had treated him accordingly. So yeah, I mean, currently, if you're thinking that there is going to be a shortage of this medicine, I doubt, because I've personally not come across anything, because my pharma guys are actually helping me out with all the patients receiving these medicines currently.
Perfect. So, in case the hospital reports shortage and they say you'll have to get it to the patient's family, is that a scenario that you've come across, and how do they go about it?
Yeah, so I that was there initially for, I think, for a week, which I faced this situation. That's when I had to call up these pharma guys asking what's the issue like, and then yeah, so we had to go and ask the attendant to procure it. But that's what I told you. We had other drugs, a line of drugs which we could use. But when we cannot use anything, we were just we were just recommending patients with, go ahead with the surgery and start with isavuconazole, because it was actually available when amphotericin B was in short. We were using isavuconazole.
Okay. So, apart from the color, what is that? Is the treatment common for these different funguses, and the way it's approached, or the ranking and other things with respect to the fatality? I know most of the things you've covered in your speech. This is just to re-emphasize on few of the questions that have come in.
No issues, no issues. So yeah, definitely the number of cases, if you compare, like uh black fungus is holds up the majority of the pie compared to yellow or the white. Yellow is very, very rare. I haven't come across yellow fungus as of now. But white, yes, one case, but it was just a vaginal infection. So we could just normally treat it with the pessaries, so not much of problem. But other than that, it's mostly black fungus which is coming, at least in Bangalore area, I'm seeing currently.
Okay. So the treatment is the same.
The treatment stays the same. Yeah, it's almost like almost the same. It is just antifungal treatment which helps us right now.
Okay. So, compared to the first wave, what has changed so drastically that we are seeing more of these suddenly?
Yeah, so like I mentioned, in first wave you wouldn't have heard people taking so much of steroids.
Correct.
Second wave, you're seeing everyone on steroids, so that is one thing which has changed. Second thing which has changed is people's lifestyle. Most of
Very.
them are in pandemic and not doing their exercise, so diabetes just went off the charts, and we seeing people fall in trouble. And there are actually people who just self-prescribed it, not knowing they are diabetic or at border of being diabetic, and they start taking steroids and they become diabetic, which they are not aware about, and they attract this problem.
So true. I mean, we've all been leading a very quiet lifestyle with a lot of eating and very less working out. So I think we have to make sure that we are eating properly as well as giving good exercise to our body so that we
That
can
is,
prevent, I mean, make sure our immunity is in good
yeah,
shape and
immunity is good. That's that. It is about immunity. Yeah,
mm,
immunity goes down, these kind of infection flare up.
true. Okay. So apart from I mean you did mention the fungus being there everywhere, and we've observed the spores in nature generally, and so many places that way. So the first time it was detected, was there an angle to it where it was considered as hospital borne, and then the research later on showed that it was there everywhere. So how did that go about?
No, so if you read the data, even in 2003 SARS, when it was infected the Middle East, that area, we had this similar kind of infection then also. So these infections are normal to florid, because the kind of cleaning, the ventilators are required, the tubes are required. These can land in, these are, like I told you, it can be in environment anywhere. These are normal, small, very minute pores which you will be inhaling right now. You won't be knowing about it, but your body is there to fight it out. So what happens when you get COVID is your immunity is just washed off. So they start flaring up. So yeah, definitely we saw a lot of we can see a hospital acquired also played a part, but not completely.
Okay. So I'll now request our lead volunteers, Thomas sir and Vivian, if Pallavi is also available. If they have any questions, they can go ahead and ask. Also, Kiran sir, do you have any question for us?
Yeah, I have a question. Let everybody finish, then I will ask doctor.
Sure, perfect, sir.
Sure.
All right, Thomas sir, we're unmuting you. If you could let us know what kind of scenarios you have faced, and if you have any questions, doctor would love to answer. Thomas sir.
Yeah, yeah. You can hear?
Yes, yes, we can hear, sir. Any scenarios that you would want to discuss with the doctor, sir?
No, that's hello.
Yes, yes, we
Hello.
are able to hear you. Please go ahead.
Yeah, I had given one question to ask whether it was due to the steroids and the patient is on is diabetic, and due to excessive steroids is the reason for this fungus, was one of my questions. And all the patients which I come across are short of medicines to treat. That was another one. And moreover, the shortage of hospitals in Bangalore to treat this fungus. So all
Mhm.
these, there are so many to list
Mm,
actually.
true.
Let me be short on that.
Yeah.
Yes, so like I had mentioned that currently the pharma company, like the government has already sanctioned about 10 other pharma companies to come up with this medicine for treating this. So yeah, definitely there are other medicine which we can try, as I've named them before. So we can actually try those till we get amphotericin was always the first line of drug right now with this thing, but we can actually switch to isavuconazole also, as per my experience. And then coming to the other question about excessive steroids, yes, sir, definitely. Excessive steroid is another one of the major cause for this. excessive steroids, if not given under good medical guidance, can cause the disease to flare up.
Yeah, that
And
was my primary concern about the steroids. So there was a counter answer for that, stating that there is no involvement of steroids for the fungus. So I had a big doubt on this, or a question mark on this.
no,
So I think it
no,
got clarified right now.
no. So basically, what happens? What the steroids does is it reduces your inborn immunity. Whatever your innate immunity is, that comes down. So that's the chance that gives this fungus the chance to just flare up in the body.
Correct. Yeah. And moreover, the hospitals, sir, in Bangalore only, I think 2 or 3 are there. Now I think there are 7 listed hospitals to treat fungus.
No, so I think majority of the hospitals are treating fungus where their ENT surgeons are available on call. As per a government protocol specific for fungus, there are about, like how you told, sir, there are about 7 hospitals which are named, definitely, but majorities of the hospitals are taking in the cases where the ENT surgeon is available to handle such cases, because it mostly goes to the ENT surgeons to take care of these kind of patients.
Okay, I'm done with the question.
Thank you, Thomas.
Thank
sir.
you.
Thanks
Thank
a
you.
lot.
Yeah.
Next up, we have plasma platelet Pallavi. Ma'am, please go ahead. You have a question? Pallavi, ma'am? Okay, ಮತ್ತೆ mute ಆಗಿದೆ. One second. Yeah, Pallavi, ma'am, please unmute. Yes, please go ahead.
Hi, Dr. Anurag. Good evening. Thank you so much for taking this session. Hi. Okay, I have 2 questions actually. One, I don't know whether I joined in about 10 minutes late, so I don't know whether it was already covered. The question that we majorly also get is, do all the ICU patients, especially the ones on ventilator, will they be are they more susceptible to getting this fungus, whether it's yellow, white, or black? Are they more susceptible to get this fungus depending on their age, or because they've been on the vent for a very long time and survived it? And the second question mainly is also with regards to how is there any way to find out whether they might land up getting the fungus in them, unless we wait for it to become bad and then they see that there is something in their nostrils or in their sinuses, and then realize that there is a fungus that's been growing there. So is there any way for us to maybe find out and kind of let the patients know that these are the ways you can check for it and things like that?
So and it's true that ICU patients needs to be under good monitor, because first thing is the immunity is going to be very, very, very bad. So if you see, there are a lot of triggering factors for this ICU patient. First is the high flow oxygen which they get. The second thing is the immunity which is lowered by COVID itself. Third, we are giving them tocilizumab, that is another immunosuppressive agent. We will be giving them steroids, which is another immunosuppressive agent. And if they are diabetic, if diabetic control was not done, or if the patient after getting discharged from COVID has not maintained his sugar levels well, then definitely he is at a very, very high risk of getting these infections currently with this current scenario. And so yeah, you are right. I mean, I would be right to say if ICU patients are more susceptible to getting this infection. That will be very true.
So is there any way that they can check whether the fungus is there before they see it with their naked eyes and then realize that the fungus is growing?
So because currently now, we don't do any. Currently we do not do any sort of test to predict this infection, because these infections just flare up. I mean, like, suppose you're getting discharged from hospital today, your immunity and everything will be under control. So once you get discharged, that's when the patient tend to lose the follow-up because of his own in health, and maybe he's already tired of so much of medical intervention that he's like, just let me be alone. That is one of the most common mentality we see amongst these kind of people. They forget to check on themselves. So
Okay.
unless if you checking on yourself, you will definitely be protective against it.
Okay. Now, for the attenders who have got the patients back home, what is the one thing that they should look out for when it comes to this black fungus? As in, not wait until it gets really bad, until it's
Understood.
flared up really bad. So maybe small checks or something. How is it that they can find out that this is fungus when they need to get to the hospital immediately?
So this is one of the most common symptoms which we are seeing right now, where patients rush to us is pain near the sinus pains. Like when you get up early morning around February in Bangalore, you have that very heavy sinus pains.
Yeah.
So that is one of the most common thing which we are seeing, and persistent headache, which is not reducing after taking any kind of painkillers. So these are the two very, very common things which we are seeing amongst patients currently.
Okay. So sinus and headaches. That's basically it.
That is one of the most common things we are seeing right now.
Okay. And one final question: without a person getting symptomatic COVID, is there any possibility of a person getting black fungus, even though they've not got to the hospital?
Definitely.
Okay.
Definitely. So same thing, asymptomatic COVID getting what do you call black fungus can definitely happen. I mean, if they like why I see these why I say yes, because they start taking steroids. One of the most common thing is that, like, because it is just circulated in the WhatsApp saying, one of my uncle took this and he became all fine, and I'll take the same medicine. That is one of the most common thing why we are seeing asymptomatic patients also having this kind of fungus. Second thing is, people who are already on steroids before are who have been asymptomatic COVID are developing this kind of problems, like who are already on immunosuppressive medicines, example steroids.
So is there any way to prevent this from happening?
Yeah, we can prevent it by maintaining good hygiene in and around the house and in and around the patients. Whenever you get your vegetables, like whenever you're giving food to the COVID patient, make sure the food is actually cooked well and boiled, because it comes from the environment. These kind of spores, it can be in your vegetable, it can be in anywhere, it can be in any produce. These are present in the environment. So that is one of the way you can do, is you can maintain good hygiene and cleanliness is one of the more major thing. And if you are diabetic, make sure your diabetes is under control. Even if you take steroid, it's fine. But if you're diabetic and you're not controlling a diabetes, it is just gonna, you're definitely a good candidate for catching this fungus.
This is not airborne, right? Just asking.
No. I mean, it is not airborne exactly. It will not spread in air, but by environmental, I mean, it can be in any. It's mostly seen in soil. Like suppose you go to a park and play, it can be in that kind of sand or anything. That fungus usually grows there in that kind of environment. So that's what I mean by environment. It's not airborne, where where by air droplets it transfers. No, but it's through these kind of daily use objects like food. I mean, you get your vegetables daily from the vendor, things like that. That's the one of the most common place to.
So if we then continue with the usual COVID protocol of everything, I think it should be safe enough for the others. So yeah, not
definitely. If you clean your food well, definitely you will be protected against it. But again, the main mantra for this is do not miss your diabetes. Even if you are at a range of being diabetic, make sure your diabetes is under check during COVID.
All right. Thank you so much, doctor. I think I'm done with all the questions.
Thank you, Pallavi, for that rapid fire question round. Now we have one very interesting question from Rashmi ma'am. How relevant is black fungus to wearing mask constantly? What are the precautions for better masking, and also should steaming be discontinued for sinusitis?
Now, what mask are we talking about here? Like the normal mask which you wear on daily basis, or what kind of mask?
I think it was normal mask.
Yeah, normal mask, because most of us wear cloth masks, right? That we wash and we reuse. And we're not using N95s anymore because they are also becoming expensive. And sometimes some people also tend to use the use and throw mask, the blue ones also more than once, and things like that. So yeah.
So what I would advise is, like what protocol I follow, every 2 weeks change a mask.
Okay.
Yeah, so that's the best way to protect against it. Yeah, definitely. I've read few datas which comment on things like, if you wear your mask for a long time, you might attract this virus. But I don't think it's like very true, because that this has about 3 to 5 layers of protection for you, which prevent this spores. But yeah, if you're sweating a lot, definitely it's a good medium for this fungus to grow, because humidity is where the fungus grows. So yeah, my mantra for this would be change a mask every 2 months. I mean 2 weeks. Sorry, 2 weeks. And if it's a washable one, please wash your mask every 15 days.
All right. The second part of the question was, should steaming be discontinued in case of sinusitis?
Yeah, over steaming is obviously very, very, very bad, because it kind of dries up your whole the sinus tract. So prolonged steaming, yeah, I would not recommend that, because yeah, it will actually kill your you need to let the body also fight whatever is there in the environment. If you just let your body just help your body with all these kind of things, is definitely going to harm you. I don't recommend steaming for a long durations.
For that matter, anything in excess is bad for health. Don't do excessive steaming or streaming on your favorite channels. Now, now I request Dr. Kiran to say a few words. I think he has a question, Anurag.
Sure.
Kiran,
I would love to
Kiran
take
sir, please go ahead.
Yeah, Anurag, I think Surakshit had raised his hand. If he has a question, after that I'll speak.
Sure, so Surakshit, if you have a question, I'm unmuting you. In fact, Surakshit was one of the major reasons for having this session, Anurag. He was the first person requesting for this. Thank you, Surakshit, for doing that.
No, that's fine. Like, I had a question. Like, as you said, every 2 weeks the mask has to be changed. What if it is continuously washed? Like, after every time when I go out and come in, so can I wash and use it?
Your voice is breaking. Can you please repeat the question? I could not get a question.
So again, like every time I go out and come back, so I usually wash my mask. So can I use it for a long period of time, more than 2 weeks?
No, I'm talking about the surgical mask which you get, the blue ones which you're talking about. I would recommend you to not use it for continuous 2 weeks. Like, if you're going out for just to buy essentials and come back, yeah, you can definitely use it for 4 weeks, if provided it's kept in a good environment or inside a box or something like that, not left outside. And second thing is, if you're washing your mask every day, I hope it's a cloth mask. Please do not wash your that blue color mask or N95 mask. I would not recommend you to do that, because the fiber comes out and the longevity of the mask goes away. So I would not recommend you to wash it. I have seen some people ironing the mask, so I would not recommend you to do that either. So those are the ways you are spoiling the quality of the mask, and the pores over there, the filters over there gets destroyed. So do not wash your N95s or your surgical mask. You can definitely wash a cloth mask, and you can definitely use it for a longer duration of time. I am not telling you to dispose your mask, the cloth mask, after 2 weeks. You need to clean it or wash it every 2 weeks, and dispose your surgical mask or N95 mask after 2 weeks. If used for everyday basis, if used on a once in a week, definitely do not need to throw that.
Okay, so I have one more question. Like the fungus in the earlier days, the black was only fungus which was found. So later on, they found white, and again the yellow. So they are pretending like even the pink fungus will gonna come. Is that true?
See, fungus can grow anywhere, everywhere. Okay, because this is the perfect temperature. The Indian temperature is perfect for the fungus to grow right now, because they like heat, they like humidity. So these are the two things where fungus grow. So this is the perfect time for this fungus to grow. Definitely, when you can definitely prevent this by keeping a good health. But obviously, if your immunity is down, any kind of infection, any kind of, if let it be pink or let it be black, there are 100 types of black fungus. There's not only one black fungus. It can be any kind of infection which can catch you if your immunity is not in check.
Okay.
Thank
I
you,
got it.
Surakshit.
Thank you. Thank you.
Okay, that was news for me. Pink fungus coming soon. Anyways, I think in the near future we'll have courses on Coursera or other platforms saying how to wear your mask, how to take care of your mask management, 3 years course. Um, we're terrified with the kind of things, but nice to see people are adapting. And yeah, small things will take us a long way. Let's make sure that we follow the norms and try to understand what works best for the equipment, which is helping us stay safe from this virus. So now I request Dr. Kiran to ask his question. Kiran sir.
Yeah. Doc, thank you so much for so much of information. I have
My
one
pleasure.
question. Yeah, I have a question. Well,
Sure.
I in our hospital where I am involved in, that's the hospital. I think I'm sure you'll be aware of it. That is Sagar Hospital. We have a patient, is around 19-year-old girl. She was COVID negative,
Okay.
but after going home, after doing the RT-PCR test, they brought her back saying that she has got still cough and things like that. And then on the CT scan, it was mentioned that she has got COVID positive. So after
Understood.
treatment, and then they said after 3 or 4 days with remdesivir and all those things, she was okay. Suddenly, after almost 12 days, after going back from 12 days, now they have said that she has got the black fungus. And now,
Understood.
since we don't treat that, so with a great difficulty, I have shifted this patient to Rangadore Hospital.
Okay.
Okay. Now, my question is it after COVID, which asymptomatic or even after hospitalization for 7 days, do they still get this, black fungus?
Yeah, definitely. Like how I mentioned before, sir, about COVID reducing the lymphocytes. So that's one of the natural killing cells for our body. So when they're not, if I would recommend you to check the NLR ratio also. If it's been still low, that's when the immunity is low, and if the hygiene is not maintained, definitely these kind of infection will definitely flare up, sir.
Okay.
And
Now,
I had seen a similar case 2 days back in the emergency where a 18-year-old boy had come to us, but we had found out with the history was he had taken steroids a year back and stopped on his own. But we don't know what cause was it. He does not have documents, but we found out. I would also ask you to, I would like you to know. I'll get into a little bit of history also about if any medication was done before or something like that. And second thing is looking for type 1 diabetes. That is another thing which we are missing out. That's what I feel. So that's why I always recommend looking for blood sugar levels 7 days and 14 days post COVID.
okay. I think I'll take your number from Krish, and then I need to connect you. With your permission, I can talk to you a little later. I have few other questions which I jotted down. I think others will get bored. I will. Can I talk to you on a one-on-one a little later, please?
Definitely, sir.
Yeah. Anurag, Krish, I'm done.
Yes, sir. Okay, sir. So we'll just take one or two more questions and then we'll conclude the session.
Yeah. Can I leave? I need to head back home.
Sure, sir. Please.
Okay.
We'll anyway
Thank
share
you.
the link with you.
Yeah.
Please do share it with people who
Sure.
will benefit. Yeah.
Thank you, Anurag. Thank you so much.
Thank you so much. Thank you so much.
Which hospital do you practice, please?
Apollo Hospital, Banagata Road.
Oh, okay. Sunil Dutt is my classmate.
Oh, okay. I'll convey. Hi, sir.
Okay, we both are classmates. Okay,
great.
Thank you. We are classmates from nursery, so you can just say for me. Okay, thanks. And even your emergency Dr. Venkatesh was my colleague in Sagar.
Oh, okay. That's great to know, sir.
Okay, chalo, take care. Bye bye.
Thank you, Kiran sir. Kiran sir has. Yes, sir. Please.
Thank you. Thanks.
Thank you, sir.
Thanks, everyone.
So Kiran sir, as you know, is the director for the 3190 COVID War Room, and he's spearheading the entire initiative under the leadership of our district governor. So thank you, sir. Thank you for leading all of us
Thanks.
and giving us the timely details and inputs. Thank you so much,
Come
sir.
on, come on. It's a team effort. Yeah, each one of them, every minute is counted. So it's not just by me. It's the entire team is working 24/7. I sincerely appreciate my core team, all the six of you. You guys are giving me so much of strength. Without you, I don't think so I would have been so successful. Thank you so much.
Thank you, sir. Thanks a lot. All right. We have one interesting question from Rubini Ganesan. Sir, it is we've been hearing that black fungus will be growing more. If yes, then how can we make sure it doesn't as a individual's duty? So, as a individual's responsibility, what are the things you can probably do to sort of ensure that black fungus doesn't grow as much as it has been anticipated to?
The thing what I would recommend is just make sure your immunity is good, eat right, and please put your mask on. So you don't it's not that you will not, this is the only infection or COVID is the only infection. There are multiple infection all over the globe. So right now what we need to do is make sure that our immunity is in check. That's the first thing, and the best thing to do is keep our immunity in check. If our immunity is good, these fungus will not flare up in the body. Our body can actually fight these kind of funguses. Just that if your immunity is suppressed, that's when these kind of infection flare up. So the only advice is make sure your immunity is in check, make sure you eat right, make sure you eat healthy food, make sure you exercise daily, and that's the best thing to do right now. And if you're diabetic, please keep your sugars in check.
Okay. Anurag, also a very philosophical question or emotional question rather. When will this all end? Is a question. So,
Even I'm looking for the same answer. When will this end?
so I mean, we've seen few other countries where two vaccinations are done, and that 14 days period after the two vaccinations, they are said to be safer, and once most of them are done with that, then you're sort of safe. But at the end of the day, I think as a norm, you'll continue to wear these masks and practice social distancing. I think for all the problems that seems to be a common solution. And yeah, you have to exercise, you have to make sure you're eating right, and also keep a smile on your face. Your oxygen level improves. So these are few things that are there. But what do you see with the conditions that are prevalent in the uh, current Indian scenario? When do we get to the kind of place that we see other countries are in? Few countries. I know we are extremely populated, and we are doing the best that we can. Do you see things coming back to any sort of normal in the near future?
Definitely. I don't think even Prime Minister Modi would like to sit in a mask and not go around the globe. So definitely, we would definitely see improvement once we start vaccinating people. Like example, Israel, it has already vaccinated about 60 to 70% of its individuals, and they have already made it mask-free country, and they've gone to pre-COVID era. Similar way is an example of Texas, Dallas. So even over there, the mask is not compulsory, and it's everything is back to normal because of, people are vaccinated there. So once you're vaccinated, what happens is the chances of getting severe infection and people dying out of it becomes very, 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 very rare. Like how rare this black fungus can be, it be that rare again. So of you acquiring the infection. So I think vaccination is actually a good way to look forward to, and with the help of the state government and the central government, I am very sure that these things should be by, I think by year end. That's what the government is claiming, and I assume by 2022 we should be seeing each other's without masks.
Lovely. I think that's a ray of hope, and we're all looking towards that. But for that to happen, again, we have to be more responsible, and we have to stay safe, and we have to ensure that people around us are safe. So let's make sure that we are creating the kind of awareness which will get us there. Let's all work together. Let's put a smile on someone's face, and also practice the art of attitude of gratitude. We are losing a lot of people. It might be our teachers, it might be people who we know. We recently lost someone from the forest department who had worked closely with us. So people are not only passing away because of the COVID, but because of depression and so many things. So make sure that you have a word with people, you're in touch with people, you have a good time by talking to them and making sure that they are safe. If they need any help, reach out. uh, PM cares, you might be able to donate, but PM cares might not be able to reach out to your friend. You will be able to reach out to your friend. So don't miss out on that opportunity, and don't lose people. Let's all work together and overcome this challenge, which is the pandemic. Thank you so much, Dr. Anurag. It was a pleasure having you with us, and some amazing answers, and a lot of questions that most of us had was clarified today. In case people didn't understand any of the technical questions that were answered, you can go through the video again. We haven't all studied medicine, but we've all become sort of COVID doctors, being part of the war room, trying to analyze few of the scenarios and getting the right help. So thank you, everyone. Dr. Anurag, do you have any closing remarks?
I would just like to say that please wear your mask on and get vaccinated, and also get your helpers and your neighbors if they're not able to get vaccinated. Please support this vaccination right now. We need it right now. And if people say, why do we vaccinate? It's not proven. If you are vaccinated, if you're not vaccinated, please spread the information, right information about vaccination, and vaccinate and stay safe and wear your mask on, please.
Lovely. Thank you, Doctor. You've been a constant support for all the questions we've had, all the queries we've had, all the support we need. You've been that one person who we can reach out to. A young doctor, ladies and gentlemen, Protractor Dr. Anurag Agarwal. We wish you the very best. Keep up the good work, and please stay safe yourself. Thank you so much.
Thank you so much. Thank you so much for having me here.
Yeah. With that, ladies and gentlemen, we are closing the session for the day. Keep up the good work, and we'll see you soon. Thank you.
Thank you so much.
Thank you, everybody.
Thank you, everyone. Krishna, don't close the